Technique of life-saving measures. Rescue breathing and finger sweep technique. What to do in an emergency. Observe these priorities when the facts of the situations are unknown, when the extent of illness or injury is unclear, or when the injured person is unconscious or unable to explain. First, check the scene and the victim. You must consider your own safety and never put yourself in danger, thus, you will be able to determine the best and safest way to give help. Next, remain calm. Losing composure may affect the behavior of the victim, may he or she be unconscious or not. When calm, you will be able to effectively determine what to do in the emergency situation. Call 911 or the nearest hospital if possible. If you are unable to get help by your own, ask assistance to get professional help. The contact person must state contact information or telephone number being used, location of the emergency, nature of the injury, and first aid given to the victim. Take note that the contact person must never hang up unless all necessary information are given and all questions are answered. If you are not sure whether a victim is unconscious, follow these procedures. Check responsiveness. Tap the victim's shoulder and shout, "Are you okay?" near the victim's ear. If there is no observed response, look, listen, and feel for breathing for about 5 seconds. Remember that if you send another person to call, check the victim while the other person is calling. Tilt the victim's head back and lift chin. Position the victim on his back while supporting the head and neck. And lastly, recheck breathing. If victim is not breathing, you must immediately perform rescue breathing, or in layman's term, breathing for the victim. Rescue breathing is given to anyone who is unconscious and not breathing but has a pulse. Here are 3 sample victims to further learn the execution. Rescue breathing procedures for an adult. To give rescue breathing, begin by tilting the head back and lifting the chin to move the tongue away from the back of the throat and open the airway. Place your ear next to the victim's mouth. Check for breathing by looking at the chest, listening and feeling for breathing for about 5 seconds. If you can see, hear, or feel any signs of breathing, you must begin to breathe for the victim. Pinch the victim's nose shut and make a tight seal around the victim's mouth with your mouth. Give breaths each lasting about 1.5 seconds. Pause between each breath to let the air flow out. Chest rise indicates the successful administration of air into the lungs. Check for a pulse. It is done at the carotid pulse or at the side of the neck. If pulse is present but the person is still not breathing, give one slow breath about 5 seconds. Recheck pulse and breathing about every minute. Continue rescue breathing as long as pulse is present but the person is not breathing until the victim begins to breathe without your help and until medical help arrives. If the victim pulse stops, begin CPR.
I've checked the scene and the victim and I've considered my safety. Let's proceed to the rescue breathing. Hey ma'am! Are you okay ma'am? Are you okay ma'am? The victim is unresponsive. Sir in the green shirt, please call 911. I might need your help, so please come back. The pulse is present but the breathing is absent. 1 1,000, 2 1,000, 3 1,000, 4 1,000. 1 1,000, 2 1,000, 3 1,000, 4 1,000. Reassess patient's pulse and breathing every 1 minute and continue doing so until medical help arrives or until the patient regains her breath. If pulse stops, proceed to CPR.
Rescue breathing procedures for a child. With head tilted back, pinch the nose shut. Give 2 slow breaths and breathe into child until chest gently rises. Check for a pulse. If a pulse is present but the child is not breathing, give one slow breath every 3 seconds. Do this for about 1 minute or 20 breaths. Recheck pulse and breathing. Continue rescue breathing as long as pulse is present but the child is not breathing. Recheck pulse and breathing about every minute and continue rescue breathing until professional medical help arrives. If pulse stops, begin CPR.
I've checked the scene and the victim and I've considered my safety. Let's proceed to the rescue breathing. Hey kid! Hey kid, are you okay? Hey kid, are you okay? The victim is unresponsive. Sir in the green shirt, please call 911 and do come back. I might need your help. Pulse is positive but breathing is negative. 1 1,000, 2 1,000. 1 1,000, 2 1,000. Reassess patient's pulse and breathing every 1 minute and continue doing so until medical help arrives or until the patient regains her breath. If pulse stops, proceed to CPR.
Rescue breathing procedures for an infant. You discover whether you need to give rescue breathing when you check the infant's breathing and pulse. Keep head tilted back. Because an infant's mouth is so small, you should seal your mouth tightly around the infant's mouth and nose instead of just over the mouth as you should for a child. Give 2 slow breaths and breathe into infant until chest gently rises. Check for pulse for about 5 to 10 seconds. If pulse is present but infant is still not breathing, give 1 slow breath every 3 seconds and do this for about 1 minute or 20 breaths. Recheck pulse and breathing. Continue rescue breathing as long as pulse is present but infant is not breathing. If pulse stops, begin CPR.
I've checked the scene and the victim and I've considered my safety. Let's proceed to the rescue breathing. Hey baby! Hey baby, are you okay? The victim is unresponsive. Sir in the green shirt, please call 911 and do come back. I might need your help. Pulse is present but the breathing is absent. Reassess the patient's vital signs every 1 minute and continue doing so until the patient regains her breath. If the patient loses her pulse, proceed to CPR.
Finger sweep technique. A finger sweep is an attempt to manually remove an airway obstruction that has become dislodged or partially dislodged. It is applicable only for the unconscious. First, place the victim on his or her back. Open the person's mouth by grabbing the lower jaw with your fingers and the tongue and teeth with your thumb. Using your other hand, sweep your index finger with a hooking motion through the victim's mouth. Start along the opposite cheek, move across the back of the tongue, then along the cheek nearest you. Establish an airway with either the head tilt or chin lift and give 2 breaths. If breaths still don't go in, continue the sequence beginning with step 1. Continue this sequence until the breaths go in or the victim starts to breathe on his own. If the person is not breathing or does not have a pulse, you will have to start either rescue breathing or CPR. Also, be careful not to push it down further the patient's airway, and it might cause jaw lock or locking, which causes death.